Today I'm talking about PCOS, that is Polycystic Ovarian Syndrome. So we actually hear about this for PCOS or PCOD very oftenly, and we also get to see a lot of patients in our day-to-day clinics about this PCOS. So what is this PCOS? Polycystic Ovarian Syndrome means the ovaries will have multiple cysts over the surface. Ovaries are actually meant to produce eggs and which gets released into the fallopian tube for the fertilization. But in PCOS, on these ovaries, you develop small cysts which are multiple in number. That is why it's called as Polycystic Ovarian Disease. So why does this PCOS occur in the first place? So other than this sitting for hours together in the same place and not working anything, it's also about the food that we intake. So nowadays we eat a lot of junk food, and all this will be cause for PCOS, especially the oily and fried items, which leads to this obesity, and obesity in turn will lead to PCOS. So how do you manifest these symptoms in you? Like you'll have hair fall loss or extensive hair, unwanted hair over the upper lip, and also the acne or pimples over the face, and the skin behind the neck starts getting darker. That also is because of PCOS. So when should you see a doctor? So whenever you find all the symptoms, and most importantly, you'll have irregular periods. So whenever you have these irregular cycles and all the symptoms that I've mentioned, you have to see a doctor for this at your earliest, and she would or he would prescribe certain investigations like hormones mainly, like FSH, LH, serum prolactin, TSH, and your other routine investigations. And if that all is normal, then it's ideal to go ahead. So most of them ask me what is the treatment and how long should I take. So rather than taking any treatment or any medicines, I would like to suggest first modify your lifestyle, go for a healthy diet and healthy exercises or regular exercise daily, at least 40 minutes or at least 3 to 4 hours per week. You will be taking certain medications which include this myo-inositol, and myo-inositol plays a very great role in reducing this PCOD symptoms. But there's no cure for this, but we have to always see to it that the symptoms are being treated and our lifestyle is modified, mainly accept or adapt a very regular and a healthy lifestyle with a lot of exercise. Because in those who are obese and are having PCOS, for them, if they just reduce their weight by 5% of the present weight, that itself will lead to vanishing of all the symptoms, and even their cycles start getting regular. For those who are already lean and like very thin or slim and still having PCOS, for them a healthy lifestyle with a healthy diet and exercise will also show the results. Irregular periods is the most common symptom that we see in PCOS. That is, irregular in the sense they don't get their cycles regularly every month. They might be getting 2 to 3 months, once in 4 months, or sometimes total amenorrhea of almost 6 months to 1 year. Or sometimes they're getting periods only after taking the medicines that is called as withdrawal bleeding. So all these can be taken care of if the PCOS comes under control by your lifestyle modification or taking myo. The other most common menstrual cycle abnormality that is seen in PCOS is the scanty flow. That is, they either bleed for just 1 to 2 days or they bleed very less, like they might change just 1 or even a half a pad per day. So that also, they might be having PCOS, so it's always better to consult your doctor whenever you have any irregularities in the cycles, either the flow or the days.